Hi, and welcome to Ibrahimian Integrative Dentistry. I'm Dr. Ariana Ibrahimian. We're so excited to meet you at your new patient exam. I'd like to give you some background information on the oral systemic health connection, so we're ready to just jump right into your individual findings when we meet you. Did you know that cavities and gum disease are two of the most chronic inflammatory conditions facing Americans today? These are all signs of inflammation, and what we know is that inflammation in the mouth represents inflammation throughout the entire body. There are really four main drivers of this oral systemic inflammation that I'd like to review with you. The first, diet and nutrition, what we eat, when we eat it. Second, oral hygiene, how are we keeping our teeth clean? Third is airway, how do we breathe? Do we breathe through our nose or do we breathe through our mouth? And lastly, who are we sharing our bacteria with? We have an ecosystem of bacteria, viruses, and fungi in our mouth called the oral microbiome. And when this microbiome is out of balance, we call that oral dysbiosis. These four drivers of oral dysbiosis, as I mentioned, really affect the entire body. So let's jump in. The first is diet and nutrition. What we're eating and how frequently we're eating really affects what's happening on a microbial level inside our mouth. So a diet that is brightly colored, rich in fruits and vegetables, lean proteins, and healthy fats are going to give us the essential building blocks to build a healthy oral microbiome. The frequency with which we eat also affects the oral microbiome. When we eat, digestion starts in the mouth and the pH value of our mouth becomes acidic and remains acidic for about 30 minutes after the completion of our meal. If we're snacking all day long, we're constantly staying in that acidic environment, not allowing our saliva to come in and remineralize the teeth. When we're in an acidic environment, we're losing minerals from our teeth, and that's how cavities start. The second thing that affects the oral microbiome is the airway. Are we breathing through our nose or are we breathing through our mouth? Mouth breathing dries out the mouth and also creates a really acidic environment. This can also lead to gum inflammation and cavities. Oral hygiene, how are we taking care of our teeth? There really is no better substitute for brushing and flossing. The products that we're using, the type of toothpaste that we're using, whether we're using oral probiotics, the type of floss we're using, are we using a water pick, all of these things can actually affect that really delicate microbial balance. Lastly, who we share our bacteria with. Cavities and gum disease are contagious. So if you are sharing in a family system, if you are sharing food, drinks, if you're kissing one another, you are exchanging bacteria with every interaction. And if one person in the family is dealing with cavities and gum disease, it really does put everyone else at risk. We're looking forward to uncovering the drivers of your oral dysbiosis and helping you restore balance in your mouth so that we can really get to the root cause of the things that are concerning you most.